Hello, everybody. Welcome to the 12th episode of the Mental Health Truth Podcast. I am your host, Marcus, but you can call me Truth. Now, today's episode is going to be from the series that I started last week, the mental health series, where the first episode I went to talk about racial and ethnic differences in mental health. Now, this episode is going to be gender differences in mental health. So, looking at mental health on women's aspect and then mental health on the men's aspect. Now, before we begin, I have about 5 articles that I want to share with all of you. And I wanted to give a few words, as you should say, on this whole topic. So, in my opinion, I think that what everyone would think would be that you mainly hear about women mental health and not a lot about men's mental health. When you hear about men's mental health, you think about all the stigma that's attached to it. You know how men don't really go to seek help anymore or anything in general. They just don't receive any help. And usually I would say, would you rather receive help or would you just try and tackle all the problems that you're going through by yourself and not really have a clear solution? So I feel like this whole stigma revolves around the traditional definition of like what it is to be a man and how people don't necessarily want to break off of that. You know, there's some aspects that you would like to keep, and there's some aspects that you know is just not beneficial for you. But I feel like a lot of people want to hold on to that, or at least a part of that, because if they let go of that, then people are going to think they're different. People are going to judge them more. You know, like you shouldn't be vulnerable, even though sometimes that's what you need. You don't even, not necessarily even be vulnerable, just like open up and ask for advice. You know, it's just a different way of wording, like feeling vulnerable in that aspect. You know, there's always different words that you can substitute to make things sound better, and just asking for advice and looking for help sounds better than like opening up emotionally and being vulnerable. So a large part of it depends on the words that we use and how we use them. So that would be like the whole male aspect of things. And whereas women's mental health, you hear a lot about they basically have a lot of resources. There's many support groups to help women, but there's not that much for men. Um, and just looking at the mental health professionals, like 80 to 90% of them are women, and very few are men. And when you think about the differences, you would think that there's certain topics that women would feel comfortable speaking to another woman, and then there's topics that men would rather talk to other men about. But if there's not that many men mental health professionals, then that leaves a very small gap for people to actually talk to other guys and receive help from them. So that's something to think about. So if we want to like help this whole ordeal, we would need more men mental health professionals. And also the cost would definitely have to be lower because not a lot of people go because of cost. You know, like think of like a guy, you know, like men like to deal with things on their own. And you pair that with something, a service, a mental health service that costs a lot of money that people don't have. So it would even further them not wanting to use it. Now, if you had a woman, you know, she would be more open to using it, you know, because she doesn't think like, oh, you know, I have to deal with this on my own. Like, if they need help, they'll rather go for help.
So let's get on with these 5 articles. Now, with these 5 articles, we're going to try to see if we could find any similarities and differences between the data that they have, the data for women and the data for men. So let's take a look at them. So we have this first article, Gender Differences in Mental Health. So let's see what they have to say about this. Women are more likely to have been treated for a mental health problem than men. So the percentage was 29% compared to 17%. You can tell by the statistics, those are very low numbers. So it just shows that not a lot of people are actually being treated for their problems, their mental health problems that they're going through. So it says women are more likely to report symptoms of common mental health problems. So common, think of depression, anxiety, stuff towards that nature. So it says depression is more common in women than men. 1 in 4 women will require treatment for depression at some time, compared to 1 in 10 men. So 1 in 4 versus 1 in 10. The reasons for this are unclear, but are thought to be due to both social and biological factors. It has also been suggested that depression in men may have been underdiagnosed because, so that is a huge point that I feel like needs to be taken into account. So not a lot of guys really speak up about it. So it makes sense that it would be underdiagnosed. Can we ever get any clear numbers? I don't think so, because there'll always be people that will not like accurately report. Like most of these are like self-reporting, and then like you find the results or whatnot. Even when like in therapy and counseling, like the first session, your initial session where you have like all of those screenings and like scales that you give people, those are self-reports too. So they may not even be as accurate. So it's really hard to tell what's really going on and who can we say have this, meaning depression in this example, and people that just don't have it or just experiencing some symptoms at the moment. So let's continue. Women are twice as likely to experience anxiety as men. So of people with phobias or OCD, about 60% are female. I feel like this number has been closer to the middle, as you'll see in some of the other articles. You'll see that it's closer to about 50% now. So we'll see. Now, I feel like it's more towards the middle again. Men don't necessarily report it as much. Both genders have their own loads that they have to deal with, their responsibilities, and just how they're perceived in society. So it comes with different anxieties that people don't really look into. So that was for women. So now we have men. This is a much smaller paragraph. Men are more likely than women to have an alcohol or drug problem. 67% who consume alcohol at hazardous levels, and 80% of those dependent on alcohol are male. So that's a huge number. So we have more men having alcohol or drug problems, whereas women have more anxiety and depression. And that's something we're going to see very common throughout these articles. So men with the alcohol and drugs. So that's more of like their way of coping with the anxiety and stress that they're going on. So Alcohol and drugs would be an example of a negative coping mechanism. Like it helps you feel better short term, but in the long term, it makes you feel worse. You need more and more just to get that pleasant feeling. So it's not good in the long term, but that's their way of coping with the anxiety and depression. So since more people are using this, it would make sense that the depression and anxiety numbers are lower because they found something to use to cope. Even though it's not a good coping mechanism, it's still a way to cope. And for depression and anxiety for women, there's no explanation of what they use to cope, but it says more will require treatment. So for women, going to therapy and having treatment would be their way of coping, whereas men would have more of alcohol and drugs. All right, let's continue. So, differences in the extent of mental health problems. Mental health problems affect women and men equally, but some are more common among women. So far we had anxiety and depression. Let's see what else. Abuse is often a factor in women's mental health problems. Treatments need to be sensitive to and reflect gender differences. Various social factors put women at greater risk of poor mental health than men. Well, it doesn't mention the social factors, so we don't necessarily know based on what they have. However, a woman's readiness to talk about their feelings and their strong social networks can help protect their mental health. Okay. Alright, so far we have abuse, depression, anxiety for women, and then alcohol and drugs for men. So let's see if we find any other differences. So they have social factors that affect women's mental health. So more women than men are the main carer of their children, and they may care for the other dependent relatives too. Intensive caring can affect emotional health, physical health, social activities, and finances. Women often juggle multiple roles. They may be mothers, partners, and carers as well as doing paid work and running a household. Women are overrepresented in low-income, low-status jobs, often part-time, and are more likely to live in poverty than men. Poverty, working mainly in the home on housework, and concerns about personal safety can make women particularly isolated. Physical and sexual abuse of girls and women can have a long-term impact on their mental health, especially if no support has been received around past abuses. Mental health problems affecting more women than men. Okay. So we have another one. We have dementia. 2/3 of people with dementia are women. Risk of dementia increases with age, and women have higher life expectancy than men. So far we have four for women. Okay, let's see. Eating disorders are more common in women than men. So we have another one. And then last, PTSD. More women are affected by PTSD than men, largely because women are more exposed to sexual violence. The risk of developing PTSD after a traumatic event is 20% for women and 8% for men. So far for women we have abuse, depression, anxiety, dementia, eating disorders, and PTSD. And for men, we have alcohol and drugs. So we have a 6-2 here on women versus men with the mental health issues. So let's go to the next article. So this was a study. They wanted to investigate psychological distress, anxiety, and depression among boys and girls. So this study was taken 5 years apart. So they gave a survey, And then 5 years later, they wanted to give them the same survey to see if there was any differences. So the results were gender differences were found for psychological distress, anxiety, and depression, with girls reporting significantly higher scores than boys. So we have another girls more than guys. In addition, young adult boys 20 to 25 years of age were more likely to experience psychological distress when compared to late adolescent boys 15 to 19 years of age. Finally, the prevalence of anxiety and depression increased substantially for girls and to a lesser extent for boys. So this one further exemplifies anxiety and depression for women and less for men. So that's another support for that. So now this is the one that I really wanted to look for. So this is another gender differences in mental health. So research shows that socially constructed differences between women and men in roles and responsibilities, status and power interact with biological differences between the sexes to contribute to differences in the nature of mental health problems suffered, health-seeking behavior of those affected, and responses of the health sector and society as a whole. So the main one that I'm interested in would be the roles, responsibilities, and the status and power. I'm thinking mainly like middle-aged when I think of status and power, because that's when you have like the most status, so to speak. So if we're just talking about jobs, it's different. So for men, as they get older, they would have more status and power, whereas women would have more of that when they're young, and as they get older, it decreases. Just based on like the amount of money paid, not necessarily the position. It's just how much you make. That's basically how it falls. So when you think about the whole status and power, if a male doesn't have the status and power that he may see other people have, or that he always wanted but he never got, and just the lack of that power and the lack of that status, he'll be seen as the bottom of the barrel, and then he's gonna feel really bad about it, and then he's going to end up, you know what's gonna happen, as most of the suicide rates are from men, and we'll get to that later on in the next two articles. They deal with suicide, so that would be something for the men category. But let's see if there's anything else. So let's see. Okay, during adolescence, girls have a much higher prevalence of depression and eating disorders, engage more in suicidal ideation, suicidal attempts than boys. Boys experience more problems with anger, engage in high-risk behaviors, and commit suicide more frequently than girls. In general, adolescent girls are more prone to symptoms that are directed inwardly, while adolescent boys are more prone to act out. So that's adolescence. Now, in adulthood, the prevalence of depression and anxiety is much higher in women, while substance use disorders and antisocial behaviors are higher in men. So now we have antisocial behaviors added in the men category. So let's add antisocial behaviors. Antisocial behaviors And then the suicide. I'm not going to include anger into this category. Let's see. In the case of severe mental disorders such as schizophrenia and bipolar depression, there are no consistent sex differences in prevalence, but men typically have an earlier onset of schizophrenia, while women are more likely to exhibit serious forms of bipolar depression. So I'm going to add both of those. So schizophrenia for men, and then we'll say bipolar for women. Let's keep going. In older age groups, although the incidence rates for Alzheimer's disease is reported to be the same for women and men, women's longer life expectancy means there are more women than men living with the condition. So I'll include that again. Alzheimer's. All right. Let's see. This is where it is. So, underlying factors, the interaction between biological and social vulnerability. Genetic and biological factors play some role in the higher prevalence of depressive and anxiety disorders among women. Mood swings related to hormonal changes as a part of the menstrual cycles are documented by some studies. So, there's one study that I wanted to glance over. So, this one's studies have reported that the frequent exposure of low-income women to uncontrollable life events such as illnesses and death of children or of husbands, imprisonment, job insecurity, dangerous neighborhoods, and hazardous workplaces places them at a significantly higher risk of depression than men. I wouldn't necessarily agree with that because it could be for both aspects, and men are more likely to be in dangerous neighborhoods and be in hazardous workplaces than women. So I don't know necessarily about that one, but the same problems in men may be associated with abuse of alcohol or other drugs and violence. So it looks like it's around the same. So each article basically are saying around the same things. So the main things for women are like depression and anxiety, and for men it's like anger, substance abuse, and like suicide. It's mainly the same things you hear. So it's mainly what the studies are showing. But let's keep going and let's wait it out until the end, and then we'll compare. Gender roles. A large number of studies provide strong evidence that gender-based differences contribute significantly to the higher prevalence of depression and anxiety disorders in girls and women when compared to boys and men. For example, the lower self-esteem of adolescent girls when compared to boys in the same age group, and their anxiety over their body image is known to result in a higher prevalence of depression and of eating disorders in adolescent girls when compared to adolescent boys. The feeling of a lack of autonomy and control over one's life is known to be associated with depression. Socially determined gender norms and responsibilities place women far more frequently than men in situations where they have little control over important decisions concerning their lives. So that's essentially it for this article. So far we have the first three pretty much saying around the same thing. So let's see if the other two will match what the first three were saying. So this is an article, Gender Differences and Suicidal Behavior. So let's see what this says. Several socioeconomic, demographic, psychiatric, familial help-seeking differences can be identified and protective and risk factors between males and females. Gender is one of the most replicated predictors for suicide. Okay. In most countries, male suicide rates are higher. In contrast to suicides, rates of suicide attempts are usually higher in females. So, according to their data, a typical male attempter is characterized as follows. So, let's take note of this. So, we have unemployed, never married, lives alone. So, those are the three characteristics. So, that just sounds like a middle-aged man. So, if you paid attention to last week's episode, where I briefly talked about men and like the whole suicide, we were talking about like white suicides, it's like 80%, and it mainly was middle age. So this is like a pure description of middle age. So unemployed, never married, and lives alone. So it goes back to the whole status and power situation. Like if your relationships never work, let's say you never had any like success, then it's really gonna take a toll on you. You're like, why am I even here? What's the point? Like I've lived X amount of years and nothing's going right for me. So it's like that midlife crisis where you start to think like, what have you done with your life? And if you're not satisfied with it, this is something that could happen. So it's unfortunate, but that's what happens a lot of the times. So let's keep going. A lot of male attempters have alcohol problems or dependence. As for the females, we found high odds in the following cases. So this is the women's detailed of who would be an attempter. So we have divorced or widowed. So compare that with the never married and lives alone for the male. Economically inactive, think of that as the unemployed. And depression. So they're very similar. It's just what you'd have to think of, like the roles of males and females, like what a male is supposed to be. Is supposed to have a job, or where he's supposed to have his life together. The typical family, like, oh, he's married, he has a family and whatnot. And for women, it's like, if you're divorced, like, it's like the main goal was like marriage, starting a family, having kids, but that didn't happen. And usually in households, one person would make the majority, and usually that would be a male. So if things mess up, then you're going to be left with nothing, and you kind of have to start your way up, unless it depends on the divorces. But that's for another topic. I don't want to get too deep into that. It's just that women make most of the divorces, 80 to 90%. And usually the male, since if you look at the household, so if the male makes most of the money or all of it, and let's say the woman is mainly like the quote unquote housewife, as you can say, so it takes care of everything at the home. So it's equal, right? It's equal. So the woman has everything in the house and the male has everything outside of the house. So it's 50-50. But one makes the income and one doesn't. So if they split apart, what happens is the courts will want to make it so that both people leave on an equal playing field. So since one has all of the income and one doesn't have all the income, half of the income gets taken out from the person that's making the income and gets put to the person that doesn't have any income. And then since this person has most of the income, this person will get most of the material things. So like, or just the essentials. So like if they both had a house, person that didn't get most of the money would end up keeping it because they feel like the person that made the money can get back to the situation they were in on their own, since they have a job, since they are doing well and making money for themselves. So that's just a little bit of that. So they're pretty much similar. So male attempters and female attempters are very similar. So now we move on to the last and final article. It was very, very dark in the room. I didn't realize it was this dark. Now the light is on. So let's see this last one. Differences in suicide among men and women. So let's see. Okay, here it is. Suicide statistics reveal that women are roughly 3 times more likely to attempt suicide, though men are 2 to 4 times more likely to die by suicide. Women show higher rates of suicidal thinking, non-fatal suicide behavior, and suicide attempts. So it seems like men are more likely to actually go through with suicide, but women are more likely to think about it and have attempts, but not necessarily successful attempts. So it depends on how they end up, like their way of like suicide. There's many different methods. Some are more lethal than others. So let's see which is more lethal. So it says differences in suicide methods. Men tend to choose more lethal suicide methods. So you have firearms, hanging, asphyxiation, whereas women are more likely to overdose on medications or drugs. So like I said, I was right on the money. So men are more likely to use dangerous options. So usually when I think of like suicide, right? If you compare like a man versus a woman doing it, for a woman you would think of like using like a blade, like those like little blades. People like using the like the pencil sharpeners, the small little portable pencil sharpeners that has like the blade on it. People like to like take the blade out and use that. And they'll like hide it, you can hide it like in your phone case or whatnot. So people wouldn't really think much about it. But that's usually what I would see, in like videos, or what I'd hear from like different type of reports. Women would mainly use like cutting or whatnot. And for men, you would think of like the typical, I don't want to say typical, but like you think of like school shooters, right? They have like the firearms, they have like the guns. So they're more likely to use that kind of way, just the fastest way possible, just to get it over with. No thinking about it twice, no contemplating, just I want it over, just one shot, it's done. So, other differences in suicide methods. This is the last part So yes, this is the last part of this part. So other differences in suicide methods. Men who were married were more likely to use firearms, whereas men who were unmarried were more likely to die by hanging. So as you can see, firearms would be more dangerous than hanging. So let's see. Unmarried women were less likely to hang themselves than married women. Okay. Men with a history of substance use were more likely to die by self-poisoning. It makes sense since they're already using substances, might as well go overboard and just basically end everything. Prior substance use had no impact on self-poisoning as a suicide method among women. Obviously, substance like heavy substance use wasn't necessarily a factor for women. It was mainly for men. For both men and women, the likelihood of poisoning was significantly higher among those taking psychiatric medications. All right, those were the 5 articles. So, going back to our list, what do we have? So, for women, we have abuse, depression, anxiety, dementia, eating disorders, PTSD, bipolar, and Alzheimer's disease. And for men, we have alcohol, drug, antisocial behaviors, suicide, and schizophrenia. So women have 8, while men have 5. Technically, you could say 4. You could put alcohol and drugs together just as substance use. So it's really 8-4. So a 2-to-1 ratio. Women experiencing more problems than men. Now, like I said, I feel like it's more even since a lot goes underreported, and you have to think about the self-reports. So when you think of like a guy, again, like the roles that he has, he's not going to really show weakness. So he could easily on that self-report just say he's not experiencing any of those issues. And then he'll kind of go like under the radar. Whereas like a woman would want more help and receive that treatment, so they're going to be more honest with the self-report. So it's a hard way to really determine the numbers. It's a hard way to really tell like what is right, and what's a little bit skewed, what's not being reported, and whatnot. So I hope you all enjoyed this episode. This is episode 12. So next week's episode will be about the mental health of the LGBTQ plus community. So I hope you all get ready for that. So thank you all for watching. And as always, Truth signing out. Goodbye, everybody.